Dr. Henry, you mentioned this Restart 2.0 that will come after the May long weekend. What sort of information should people expect to get around how this is going to work, how it's safe to unwrap ourselves, and what sort of communication plan will be part of that?
So there will be a communications plan. I think what people need to know is nothing is changing right now. We are in a place where we're in a good direction, and we need to keep it up. And we need to keep it up at least through the end of the May long weekend. So don't start thinking about making plans now until after that period of time. And then we'll be going back to the same approach that we took last May. Where we started gradually increasing our activities based on risk, based on monitoring what is going on, how many more people are being immunized, how our case and transmission rates were going down. And that will continue through into the summer. I think we can start, if things continue to go in the right direction, then by the time we get to our July long weekend, we should be able to do even more in terms of having small gatherings, in terms of having those events that are so important. And we think back to last summer, how we were able to do that successfully and safely. So people planning weddings and things like that, we still will have the need to be cautious, and through a period of time, make sure that we are keeping the virus down. And then as we move into the fall, if things continue to go the way we expect, and I put these caveats in because we learn all the time. This virus has taught us that we cannot be complacent. We know, I'm watching very carefully what's happening in the UK, and I think that's a very good example for people to think about. Slowly, gradually reopening, getting back to doing the things that we need to do in our lives, and not getting through the pandemic part, learning how we can safely live with COVID and be able to detect clusters and outbreaks quickly, get back to the public health work that keeps these things controlled, like we do with every other reportable communicable disease, things like influenza, things like measles. So that's the goal, but it's going to be slow and gradual. We have learned that from watching around the world, that if we move too quickly, the virus can take hold again, even when we have immunization to protect us.